Transferring critically ill patients is common, but it's not without its risks. Indeed, these risks were known as far back as the Napoleonic Wars, and they're the reason why specialist transfer and retrieval teams use escorting personnel with dedicated knowledge and skills, specific equipment, and they apply close scrutiny to the transfer process itself. So, why worry about transfers? What is all the fuss about? It's been shown that a high number of critical incidents occur during transfers. Now, some of these incidents will without doubt occur wherever the patient may be, even if they're static in an intensive care unit. But a significant proportion of the incidents can be attributed to the transfer process itself. So, in short, we can consider the transfer as a clinical intervention, and like any other clinical intervention, it's important to appreciate the risks. Where there are risks, it is our duty to make sure that we can reduce them through training. There are certain aspects of transfers that could be improved through better understanding of certain areas. The physiological effects of transfers on the patient. Appropriate stabilisation and preparation prior to the transfer itself. There are legal aspects which need to be considered. It's important with experience that you can anticipate and prevent common problems. It's also important that you understand your environment and the equipment. And lastly, there are specific issues associated with the different modes of transport. It's worth considering that if we are transferring the sickest patients in the hospital, it seems pretty reasonable to make sure the escorting team have the appropriate knowledge, skills, dedicated equipment to make sure that the process is as safe as is humanly possible. So in summary, transferring critically ill or injured patients is a clinical intervention. Such interventions have risks, but you can reduce these risks through improved knowledge and training.